Good to be amongst you all as we talk about medicine for the greater good. Who am I? I am Panagis Galiatsatos. I am a associate professor of medicine and oncology at Johns Hopkins University. But more importantly, I'm a son of Baltimore. And I'm thrilled to be here today amongst you all to talk about something that I co-created and now co-direct, medicine for the greater good. Over this time together, I'm going to discuss my journey into medicine for the greater good. I'm going to discuss what its impact has been, and more importantly, what its future holds. And it's an exciting aspect for me, a lot of it because, as you're going to see, it stems from who I was as an individual growing up. And, when I was a child and remembered being told, consider becoming a doctor, I had no idea what a doctor really was, other than the person who jabbed me with some sharp things and gave me a lollipop at the end, right? I was a kid. And now I'm being able to sit here kind of molding this identity of being a physician citizen. And I'm hoping you all get to appreciate this as we dive into the journey together. Now, if you have questions, comments, whatever you'd like to do, throw them into the chat box. I will try to do my best to tackle them as we go through. But thank you for taking this noon hour to be with me and everyone else that I'm bringing along with the journey. Who else am I bringing? Well, I always like to start off with a thank you slide. And this slide could be much longer and should be much longer because this just represents the community of Hopkins that's supported medicine for the greater good. There are countless others outside of Hopkins who continue to promote this work and do the good work that we need in a time like this, in a time like the future will hold, in any time, right? We're trying to really define healthcare systems and what medicine means for people out in the community and so forth. So these are colleagues, these are friends, they're people that mean the world to me, and medicine for the greater good would not be here if it wasn't for their support. So with that in mind, let's dive in to a little bit of the journey. How did we get here? So I have the honor of having an office where I can look out over my right shoulder and see where I grew up. So this is my office at the Johns Hopkins Bayview campus. The arrow points to 730 South Ponca Street, where it was the first house my parents bought when they came to the United States in 1971. Two immigrants from Greece coming here to join other family members, began to work at H&S Bakery, and then over time kind of went into their respective vocations. My mother was a seamstress, my father was a union painter, actually even painted a variety of places at Johns Hopkins. This is my inspiration. Every time I look over my right shoulder, I'm reminded of where I grew up. These are our alleyways that we grew up. And this, I wish I could take you all in time travel with me to these alleys of Baltimore City, because we were flooded with, Greek population, local Highlandtownians, right? It was just every Easter was a big celebration, and you could smell the lamb that we were roasting. You could smell the food. You could come and taste it if you like. Everyone was invited. But in these alleys is where I would say my identity began to form in understanding how important community is. I may not have respected that understanding at the moment, but over time, made me understand as a physician, we need to rely on one another in order to kind of promote health in its most equitable fashion. There's plenty of people that have influenced me, and my mother and father were some of the first. But for me, was my dad as well. My mom as well, but my dad. Here's my dad painting into his late 70s. And from that standpoint, into the late 70s, still painting, he's going out into the community where he brought his family initially. This is him. Not taking a dime from the neighbors, etc., who were asking for his assistance and his help. He is doing it because they've asked. And my community was like that. My uncle Andy, repaired cars. So if someone's car wasn't working, he would be called on, come and help, and you do it. My mother was a seamstress. She made many prom dresses, many suits for the men and women of the neighborhood. We all just kind of helped each other. And wherever the gap may existed, we were there to overcome. Keep in mind, I grew up in a very heavy part of an immigrant community, and English was not the primary language. So I just remember growing up, other Highlandtownians, other Baltimoreans will come in, helping my parents read mail, go through some of the English writing and kind of translate for them. It was great. We all helped one another. And from my standpoint, that I got to see modeled over and over and over again. was like, this is great. This is what a community is. Now, as I got older, as I got older, young adult, not young adult, teenager, yeah, I got the American question. What do you want to be when you grow up? What do you want to be when you grow up? And, you know, not that I wanted to be a doctor, but my community kept saying you should be a doctor. Now, if you're wondering why, were they looking at my grades and test scores? They weren't. They weren't. No, none of that. I think I got labeled that because of a career of exclusion by my community. So I grew up with two other cousins. My older cousin was really good at soccer. He was the athletic one. My younger cousin was the handsome one. And so I became kind of the book smart one. Though I was good with books, I did do well in school. I had good grades. And so especially for the immigrant community, they said, all right, if you're that smart, what's the most prestigious thing you could be? And it was a doctor. I didn't know what that meant. Like I said, I thought of the doctors as those ones who jab me, I go, they see me, I get lollipops and stickers. So I didn't know what that meant. And so I thought, well, let me try to at least understand what a doctor is. And I began my first ever volunteering opportunity. There it is, my ID card from Johns Hopkins Bayview in 2001. That's why I always like to gloat. I think I'm Hopkins's longest running faculty member, starting at the days when I was just a volunteer. But even that didn't give me the best understanding of what being a doctor meant. I just felt like I was more of an audience member watching them act and so forth. But, we all go to this profession of doctoring for various reasons. Even now when my mentees ask me, why did you become a doctor? I don't still have the greatest answer because it is a calling. But for me, I think the biggest thing is it was my community's belief in me. You should be a doctor. And over time, I felt like, all right, if they're seeing something in me, I'm going to pursue it. So I went to medical school at University of Maryland, and then I came over to Hopkins, specifically the Bayview campus, to start my residency. And I was excited. The reason why I was excited to be at Hopkins Bayview, as you can see, it was the hospital that served my community. This is my ultimate way of being my dad and my mom, right? Giving back. My dad would go and paint homes. My mom would fix anyone's ripped clothing or maybe make the prom dresses. I was able to give back. I wasn't just going to go see patients. I was excited. I was going to go see people that I grew up with in kind of the most vulnerable state where I can give back. But even just immediately into my intern year, medicine didn't feel right. And not in a sense of, did I study the wrong things? No. I felt this bit of disconnect. I felt like I was in my own bubble practicing medicine. I'd see these patients in the hospital. Again, these were community members. I knew a lot of them where they grew up. I knew a lot of them where they lived. I knew the streets they were. I knew the back alleys. And I'm sitting here being like, I could flood them and overwhelm them with a lot of information about their diabetes, heart disease, about their COPD. Not a single thing is going to make a dent to them. I could get to know them as a patient, of course, and I do. I got a little bit of an edge over my colleagues because of where I grew up. But I was practicing medicine. I wasn't really practicing health. And the oddity of that is because everything we were sharing with them, I could sit in the back of my mind being like, oh, that's going to be tough for them, right? None of these diseases that they were going through and trying to manage are going to be managed alone with a medication or with a doctor's recommendation that can be blanketly stated as, oh, eat better, exercise. When you tell someone who's living on Ponca Street, just try to walk a few times a day in order to kind of help out with some exercise. Well, 730 Ponca Street, you're right near the proximity of the 895 and 95. There's a lot of highways there coming in, a lot of traffic, and it's going to be tough to walk around that area. Right. So what I was realizing, what medicine was missing is a true insight of the community, of the neighborhoods that people were growing up, of what their lives were like. We practiced medicine by knowing the science and knowing the patient, but we were kept from really practicing health because of a short-sightedness of really understanding what's happening outside of the hospital walls. In 2013, 2014, we planted the flag, Medicine for the Greater Good. I had great faculty leadership, Dr. Colleen Christmas, Dr. David Hellman, Dr. Richard Bennett, who also brought Dr. Daniel Hale to be kind of a mentor to me. We planted the flag, medicine for the greater good. And I was a chief doing it. And then in my fellowship year, along with some other great colleagues and faculty members. And over those 10 plus years, early on, still in training, I'm not faculty yet. I was probably Hopkins's favorite employee because I was doing all this work without asking for a single dime. Over these years, what I was trying to understand is, what does health mean to the community? Because whenever I would show up and say that, what does health mean to you? Whatever the topic was that I was being asked to discuss or promote, no one ever said, oh, it means understanding the genetic predisposition to my chronic obstructive pulmonary disease. No one ever raised their hand and said it would be the most appropriate inotropic intervention for my congestive heart failure. No. Actually, in all fairness, the number one answer I used to get when I asked what health means to people, whether they were kids or adults, the answer was always jobs. Now, that answer may have taken a different form, saying, oh, it's having a purpose, or it's having employment, being able to put food on the table. But clearly, when I would hear this answer, it made me, it always humbled me, humbles my colleagues. We're sitting here to talk about medicine, but in reality, they want to talk about the holistic notion of health, right? Everything to them is health. We launched Medicine for the Greater Good. And in these years, trying to promote health that aligns with community's identity, I think we hit some success. Look at how many interventions. This is just Baltimore City and a little bit into the county. Look at where we've been. And if you know Bayview, you know the geography, we're really on the east side, closer to that Eastwood Dundalk. We're up there in Northwest Baltimore. We're down there in Southwest Baltimore. We are being asked to come and engage with a lot of community-based organizations, social networks, and neighborhoods. What's been driving that, in my opinion, has been a two-pronged approach of medicine for the greater good. One, how do we create physician citizens? And two, how do we create community liaisons? And from a physician citizen standpoint, this excites me, because where I'm at now in my career, and people were telling me, all right, to get promoted, to get a professorship, et cetera, what are you going to be? A physician scientist, physician clinician, physician educator? And I would respond, I wouldn't be a physician citizen. And no one really had an answer to what that is. They look through the paperwork, they're like, it's not listed here, Dr. G. So you got to explain to us what that meant. Well, what we began to do with Medicine for the Greater Good is going to the residents, going to the medical students, going to faculty and talking and teaching to them about the significance and importance of community engagement. We will do this and really try to promote it, and people would understand, but no one ever took a leap to say, all right, let me make this full time. Two of my students, I'm quoting them there's Anila Chowdhury, we'll come back to her, and there's Kat Alberg. From my standpoint, what I realize is if you can get, especially to the medical students and the residents, and mold their professional identity at this juncture, you're likely to really make a significant impact. Dr. Chowdhury now, a fellow in Philadelphia for pediatric cardiology. Her and I spoke last week as I discussed inviting her to co-author a chapter with me. She made it clear, she's like, Medicine for the Greater Good was the most significant thing I did. And a lot of it because she got to be the physician she always wanted to be by engaging with the community. Dr. Kat Alberg as well, now a critical care fellow at Penn. She made it clear, while the hours spent in a hospital made her a physician, the time spent in the community made her a physician citizen, and she's never looking back. I was touched. But what about the community? Well, and this is more pictures of us. There it is. There we are. This is just some snapshots of the schools we're at. And for me, the significance of being amongst the students, right? Whether we're in faith-based organizations, whether we're in housing units, or whether we're in schools, the proximity to being there, being bedside by the community means a lot, right? We're not just sending out a pamphlet, we're taking our time to engage. And keep in mind, this execution was built on showing up to PTA meetings so we can kind of get a cultural insight into their identity. It was having meetings with teachers. It was showing them our curriculum and do they approve of the pedagogy. We took our time to invest succinctly into the engagements. And these are some of my colleagues that got to do the work. It was so profound, and many of them still continue to do it. On the opposite end, or the opposite side of the coin, right, is the community liaison. And what we've done for the first 10 years, right, 2012 to about 2020, right, we're going to bookmark that, right, because there's a significant next chapter. We focus on creating these volunteers called lay health educators. And these were volunteers. Essentially, what we did was we would reach out to these various communities, oftentimes faith-based organizations, and there's a sociological reason for that. We talk to the leaders and say, you tell us the most influential people of your community. And if you can identify them, can we take them, train them into what healthcare systems can't do? And that way they can focus on the community engagement aspect of promoting health to pick up the pieces where modern medicine can't. Nothing against modern medicine. We can't prescribe the diets that are accessible to a community. We can't prescribe the transportation needed to get person A from location 1 to location 2. Right? The social factors are constantly impacting health outcomes. We can't overcome a lot of those, so we're going to work collectively, collegially with the community. And these lay health educators were powerful. We got interviewed by WIPR. This is Reverend King. This is Imam Hassan. And Reverend King said something so simple during this interview, simple but powerful. It was during this interview, I would admit, Reverend King's from the West Side, Imam Hassan's from Northwest. I'm an East Side guy. I know I'm a physician, but I'm claiming my territory for Baltimore on the East Side. And if you know anything about Baltimore City, is you can live in these demographic areas and never interact with the other parts of town for reasons that are beyond this conversation, but happy to tackle. But you kind of see in this siloed vacuum. Sheila Katz asks Reverend King, why do you trust medicine for the greater good? Reverend King and I, at this time, we were implementing a variety of projects to help both families and specifically the kids living at Poe homes over on the West Side. And we probably had a little over 30 meetings by the time we had this, and these meetings could be just me listening, me coming, and really not discussing anything other than just being present. That's all I was doing. I never felt like I was doing much prior to this interview. But when Sheila Katz asks Reverend King, why do you trust medicine for the greater good? His simple answer, yet powerful, was, they show up. And I realized a lot of our community efforts and engagement, the trust we are going to need to build is going to be built by showing up. Medicine for the greater good, up until this time, I would say we had some success, right? The academic success, right? We were publishing, we were putting out papers. You can see Anila Chowdhury, first author on this great lay health educator program we did for the Syrian refugees at a local mosque, specifically Imam Hassan's. We got the academic success. We're nailing it down. Great. Okay. And then March 13th, 2020, Governor Hogan at the time does what a lot of other governors and leaders did for the United States. We're gonna shut down the state. We're going to try to mitigate the spread of SARS-CoV-2 that is causing COVID-19 in an effort to save lives. March 14th, 2020, Saturday morning, I wake up to a phone with a little over 5 missed calls. It's 7 a.m. I woke up pretty early, checked my phone around 7 a.m. and I was like, what's going on? Started calling back these community leaders who were calling me, making it clear this is going to still impact our neighborhoods, our communities, disproportionately to others. Sandtown, Southwest Baltimore, Highlandtown, Pimlico, these areas are not ready and prepared for these kind of lockdowns. The people aren't going to be able to abide by them. Many people need to go to their jobs. They work in construction. They were union painters. They were going to go out. And Dr. G, many of these are multi-generational homes. Like, there's a lot of complexity from a social standpoint that's going to be impacted here. March 14, 2020, March 16th, I apologize, March 16, 2020, well, we began our work. What we did was we pulled on the strings of the social networks we've had, a little over 200 individuals here in the city, and said, all right, what do we need? What do we need? What do we need? What do we need? And one of the first things that became evident was we just need the right information outside of the cacophony of this noise, streamlined by someone we trust and delivered in a way that's actionable for us. That's all we want, Dr. G, right now, right? Like there's so much out there. We want to know how to save our lives. So we began. One of the first efforts we put together on March 16, 2020 was something called a community call. We emailed, we called all these community leaders, said, listen, 2 o'clock Monday, here's the call-in number, join. I and an infectious disease specialist, Dr. Jonathan Zendelman, are going to talk about COVID-19. If you have any questions you want us to answer ahead of time, you email, you send, you text. We send out the emails. I was expecting probably no more than 50 people to show up. We were asking people to drop everything Monday afternoon at 2 o'clock. First call, 234 people attended. We did it again on Friday, a little over 270 showed up. Did it again the following Monday. Now we're reaching levels around 300. The community and its leaders were spreading the word. Join these calls. You can trust them. We know them. We're vouching for them. Imam Hassan, this is July 2020, right? A few months into the worst moments of the pandemic. Organized kind of a community rally in order to allocate food and a variety of other just resources for people who were trying to stay at home. There's one physician and one physician's group who showed up, not because he didn't invite others, he invited us, Medicine for the Greater Good, and we were there to discuss COVID. That's it. His big thing was, you're here to tell the community what's going on. And those were some of the most powerful hours because the community was frightened still. They were scared, but more so because of again, just so much misinformation going on. They just didn't know what to believe or how to believe or what to act on. Imam Hassan did countless events like this, and so did other faith-based leaders, and so did other just community leaders. And we kept getting invited, and we kept showing up. Because what I was trying to make clear is, I'm not your front line. I'm a physician. If you're coming to see me, I'm your last line of defense. The front line is you all who can take this information and share it to keep people safe. And then when schools were eventually asked to come back, schools did the same thing. The teachers, all they wanted to do was just teach. But it's very hard to just teach when we have a public health crisis of the pandemic. So the schools reached out to us. This was Medicine for the Greater Good actually joined forces. This is one of the beauties of Hopkins, right? All these engagements you can have. We joined forces overseen by Alicia Wilson saying, listen, bring everyone together from the School of Education, Annette Anderson, School of Nursing, Catherine Ling, School of Public Health with Vanya Jones. Bring them together, right? Our volunteer corps service was sourced with Mindy Levin. Bring them together, and we created the HEAT Corps. And we were going to tackle misinformation, but really what we were going to tackle is science literacy. We wanted the students to understand what's going on, but in a way where we can ground them in the science literacy so they can kind of continue to grow from it. But also making it clear that every single one of them can help us put an end to the worst moments of the pandemic. That's what we wanted to emphasize. These students, they wanted to be able to help. They wanted to not feel trapped with all this information. So we were invited. And actually, we were invited again in order to tackle the second part of an outcome of the pandemic, their mental health crisis, and we came back. By the way, those community calls that I spoke of earlier, we're going to come to them in a second. All right, I'm leading you guys on. All right, so now we're another year forward, and Mayor Scott and the health commissioner at the time were like, okay, we need to really reach out to the city. And there's me, right? I'm the one with the long hair, my pandemic hair, didn't get the haircuts. My poor wife had to put up with me during that time. But they pulled on us saying, hey, help us get out to the faith-based community. The religiosity of Baltimore is rather powerful, but it stands for so much other things because of what these community-based organizations can do. So come and help us reach out to them to do more COVID-19 information, spreading more COVID-19 information, gathering more COVID-19 resources to distribute. And my colleague, Dr. Sharita Golden, my mentor, she oversaw a lot of this. We had government affairs like Selwyn Ray, Michael Preston. They continue to help. I mean, again, Hopkins's strength was pulled here. And I'm sitting here humbled because I was just pulling on the same strings of Medicine for the Greater Good that we did before the pandemic. And seeing the best of Baltimore come up and rise was profound. Community calls, by the way. 2022, Kimberly and I were looking to kind of say, all right, let's put this behind us. We went from twice a week to once a week calls, and we put out an email saying, oh, look, we're likely, we're in a better time of the pandemic. We're likely to put this behind us. And we got so many emails saying, don't. you guys do a good job. Like, we can talk about other things other than COVID, but we love being able to gather and listen to streamlined science, medicine, and healthcare delivered in a way that's understandable. It's delivered in a way that's actionable. And more than anything, we trust you. We trust you all. So the community calls have continued. And we've to date, invited scientists. Actually, my favorite aspect of the community calls, for instance, was Father Bob emailing us almost 12 hours after the report of the US Surgeon General saying alcohol is linked to cancer. Father Bob, formerly at the Sacred Heart of Mary over at Highlandtown, the Highlandtown Cathedral, emails me. Dr. G, what are we going to do about the wine at Eucharist, essentially? And so what we ended up doing was touching base with Dr. Otis Brawley from the Sidney Kimmel Comprehensive Cancer Center saying, hey, do you want to come and talk to this? And he goes, I'll do you one better. We'll invite the public health scientist who wrote the report. And we did. And we had some great engagements, and we continue to have these great engagements. And we've invited so many other researchers and scientists just to come and talk to the community from topics like H5N1 to how do you approach a geriatrician? How do you prepare for a primary care clinic? What's new in cardiology? This is meant to be a platform for people just to come and no longer be the scientist and doctor, shed that identity and just be a community member, talking one-on-one in an intimate way with the community as they ask you real-time questions and concerns and thoughts. To me, this kind of organizational informational platform is something that I didn't expect MDG to take on, but it was something that the community has asked us to do. So, still going on. So if you want to listen to it, you're welcome to. There's plenty of dad jokes that you hopefully enjoy as well. So where are we now? I will tell you where Medicine for the Greater Good was going up until the pandemic. I had an idea, I had a thought, but a lot of it was really centered, and there's nothing wrong with what I'm about to say, and I don't mean to make this disingenuous, but a lot of it was centered on academic success. We were doing the publications, we were securing grants, we were impacting mentees alike, and faculty were joining us. But the pandemic, something changed in my colleagues and I, that were doing Medicine for the Greater Good. We were having success, but clearly more is needed. I mean, when we joined many other physicians, faculty, scientists, et cetera, during the pandemic, we realized, even more than ever, this moment in time of this bidirectionality between a healthcare system and the communities it serves and the neighborhoods it's residing in, we clearly need to do more. Or not just more, we clearly need to take this moment and make it a permanent movement. So I'm faced with, well, how do you take success and make it significant? And then how do you make it from significant to just standard of care? Well, first, let's go back to what we know we do well. All right, so in 2023, we started our HEAL initiative, Health Educators, Advocates, and Leaders. And with it is because what we know we do well with regards to community engagement is still working with a community liaison and working with the right physician citizens or nursing citizens or public health citizens, right? The science citizens, right? The scientist citizens. It's working with them. So we launched, Medicine for the Greater Good launched its first undergraduate course in order to get the undergrads already involved. We have these teachings in the School of Medicine, School of Public Health, and School of Nursing. We recruit active faculty wherever you're at in your career. Why not come and talk to the community, right? Tell them about your research. Share with them what's going on with what your struggles are. How can they get involved? Or how can they just listen to it? My goal, our goal of MGG has really been strengthening what having a Johns Hopkins in Baltimore means for Baltimore, for the city, for the county, for the state. Where we have this jewel of great intellect, let's share it, let's discuss it, right? Science can feel like a string of objective facts that have, how do you make it purposeful into my culture and my identity? We'll do it through these platforms, right? And especially with the undergrad course, it is a teaching of the sociology, of the science of the sociology around community engagement. So when they leave after my spring semester, they'll be able to understand this is how you approach the community in order to establish kind of these weak ties built on certain variables of homophily and impact the social cohesion to promote health and wellness. That's the goal. And getting the next generation of doctors and healthcare leaders to value this has been it's been one of the biggest, most rewarding things I've done. To date, I have written a little over 300, so 303 letters of recommendation from high school students all the way up to resident physicians. I've even written a few promotional letters. 303, no exaggeration, exact number. I'm counting on those 303 to continue MGG in their respective platforms. It makes me proud because that's what we're trying to do. So that's one aspect, right? What's the other side of the coin? Community liaison. We've teamed up here with the healthcare system, specifically out of Howard County, with Amanda Toohey and Raven Colston, to make community health workers. Remember what I told you, what my number one answer would be to what does health mean to you? Jobs? Okay, well, we'll still do the lay health educators. That's more volunteership for the community. Let's focus on community health workers, right? This is, a lot of individuals have been gaining traction, showing the worth of CHWs. Our job now is not just only to help make another generation of community health workers, but grab them from vulnerable regions of the city, of the county, of the state of Maryland. Show the economic worth, right? There's plenty of academic successes that we have shown. How do we support them? How do we make an organizational approach where they all feel supported and can share their struggles and successes? And then more importantly, how do we plug them into community-based organizations to show their value and good return of investments? So yeah, this takes a lot of economics to meet the ethics of what we want to achieve. But to me, this is the next leap of healthcare. As I said, we will practice medicine. We do a good job of it. But health is much more comprehensive. And if you think this is just a novel idea, it is not. This stems from Sir William Osler when he returned back from Germany, working with Dr. Virchow, seen as the father of social medicine. He reflected on tuberculosis, making it clear that it is a social disease with kind of medical constructs, right? Even our founding father of modern medicine here at Hopkins understood the need to have not just be bedside by the patient, but to be bedside in the community. And this is what we're trying to continue. And so as I wrap up, as I said, I have the honor, what an honor. If I'm ever hit with a writer's block, if I'm ever hit with a paucity of what to do next, when I'm in my office, all I have to do is look over my right shoulder. And there's the neighborhood I grew up in. And as we continue moving forward with medicine for the greater good, our goal is what I said earlier. We are off the successes that we'll achieve, not just the academic ones, but even the ones that Reverend King highlighted. Dr. G shows up. The ones that Imam Hassan highlights. MGG is here for us, right? The ones that Anila Chowdhury said. It's the most important thing I did as a medical student. How do we take that success and make it significant beyond just kind of our reach, but truly into the healthcare systems? And then we pivot into making it just the standard of care. In 10 years from now, we'll be just discussing MGG, whatever name it may go under. It could be just the Office of Social Medicine, whatever it may be, but discussing how healthcare systems are taking one alike. And I know we can do it. We did it for the pandemic. We had to, right? Because we realized that in order to stop that virus, it took the front line of the community. So with that in mind, other last minute good news. If you loved this hour with me, well, then my book, Medicine for the Greater Good, is forthcoming. JHU Press just kind of put out a text message to me saying the final edits were approved. So if you want more of this, feel free to pick up the book later on. All right, here's the email. If you want questions, oh, there it is, the email. I'll leave that up. I'm going to go through the chat box and see about some of the questions you all are dropping in. And oh my, I love this. You guys are dropping in a great deal of questions. So I'm going to share. Cindy asks, it sounds like the lowest hanging fruit is medical professionals putting in time in the community. I'm not a doctor, but I feel like time must be a scarce resource in your field. Is there anything that hospitals or schools of medicine can do to encourage this volunteerism? I love that. And I would actually, from my standpoint, I would say, while time is a scarcity, it's a limited resource, but a lot of the people that have approached us isn't just, I want to volunteer. A lot of it is meant, can we help create the culture of understanding why community engagement is important? For instance, a lot of scientists, they're not looking to just volunteer, they're looking to kind of talk about their work to the community. So we will put them with that as the community allows us. We will identify communities and say, hey, would you like one of these scientists to come out and talk about their work in a manner that makes sense? So for a lot of the physicians or scientists, going out into the community is just so they can be seen as a collaborator with the community to share their work. For others, it is just building the culture, right? So it doesn't feel like they have to go to other way to volunteer. It just feels like, okay, I'm taking care of the same kid coming in with an asthma exacerbation. How do I help create an air filter, an air purifier at home? Monday morning at Armistead Elementary, we built 20 air purifiers with the students there to take to respective neighborhoods. So Cindy, it's a great question. I think what we need to do first is just establish the culture that wants to be able to go out to the community, either just sharing their information or literally putting hands-on in some activities. We have to establish that culture to recognize the value of it. And then once people understand that, then of course they'll work with us in order to have the leadership allow it and so forth, and the other dominoes fall. But first, I think you need to establish the culture. All right. Oh, and you had a followed up on the question, and on the same line, many low-income people don't have a ton of free time. How do you get them to carve? Yes, love this question. When we used to go to McCullough Homes, it was very clear to me, as Miss Margaret said, I changed her name a little bit. Dr. G, being poor is time consuming. So here, what we honestly do is just work with the community liaisons that we have identified and work with. I don't need to work with the entire community. I can just work through them. And especially if I can make them CHWs, that's a paid position. So they are getting paid for their skills. So that's who we tend to work with a lot of times, of being able to reach a lot of individuals. Because again, you're right. Time is also a limited resource for them as well. So we'll try to work with the most influential people out of their community to distribute the information, the resources, et cetera, of what they need. And also we try to make it applicable to their timelines too. We'll work with their timelines. We're not on a timeline. We're on their timeline. We work at their pace. They set the tone, they set the pace, and they let us know what their goals are. All right, next, Ms. Barbara, you asked, with the recent measles outbreak, how would an organization like MGG work with their communities, especially with the trust? Yes, so a couple ways. First, we've had discussions about measles on our program. We've actually invited pediatric critical care doctors to discuss the worst outcomes of it. Second, the community is already emailing us, right? We had one of the congregations out of Dundalk say, Dr. G, can you or your team come out and talk to our community about the measles outbreak? So what we're doing right now, Ms. Barbara, is trying to do what we did with COVID and did with other kind of public health concerns. We are accessible. We will go out when they request us to talk about measles in a way, or whatever other public health crisis, in a way that makes sense and is informational to them. Here's the other big part when we go out. Even if we send out the experts, there's still going to be a lot of unknowns. And we make that clear when they ask good questions. Do I have to get an updated measles shot? Honestly, there's no guidelines on that. So you're going to have to individualize it. So let's talk about what that means. So yes, right now we are being asked to come out just to have these conversations with our community. So I think one of the ways we're arranging ourselves and organizing ourselves is the accessibility part. We don't say no, right? And we have a good bandwidth to send individuals out. Next. All right, Frank, it's so touching to hear about your journey into medicine. Thank you. That's very kind. Have you had the chance to mentor 303 letters of recommendations? Yeah. And by the way, I have a trick to writing these letters of recommendations, because people always ask me, like, how do you do it? How do you do it? So my trick is, if I meet a student, meet a resident, meet a physician, well, not all physicians, not my colleagues oftentimes, unless they ask for promotional letters, but usually, in the hierarchy of academia, if I meet others who've requested time with me, second I finish, I open a file and I start writing my first impression of them. So by the time, Frank, they ask me for letters, it's already finished, especially if they went out and did engagements. Like, I'll call the school or I'll call the church, hey, how was Kat today? Did she do good? Hey, how was Anila? And I'll put the quotes down. So the way I turn these around is I kind of keep an active, dynamic, updated letter to constantly write for them. So yes, mentoring means the world to me, because the way you are going to sustain this, in my opinion, isn't just making it significant now, but it's making the next generation of healthcare scientists, physicians, clinicians, nurses take this on. And yes, my reach of 303, exponential growth with my other colleagues and their significant reach and so forth. So mentoring is a big key part of what we do. Cynthia, you wrote a retired family physician who practiced community-oriented Baltimore community-oriented primary care in East Baltimore community centers in the 80s and 90s. How have you involved community primary care practitioners in your program? So, great question. And for someone who too was influenced by the primary care physicians out there, if you know Kenneth Williams, for instance, took care of my entire family, and he was one of the first doctors I got to shadow. And the way I try to engage with them is not to impede on their time. They're overworked, overburdened, and under-resourced. But I make it clear we have some resources for you if you ever need it. Right? Some of the community-based organizations that have CHWs to help out with social prescribing, they're ready to go. So, hey, if you have a practice here and you realize your patient has food insecurity, here's where you can send them. Here's where you can send them for transportation issues, or here's where you can send them for A, B, and C, or these resources, et cetera. What we've tried to do is reach out to a lot of these primary care clinics and sites and just let them know where MGG can say, we're vouching for these organizations here and there. So if you need any resources, they can also reach out to us. What we're trying to do is be seen as a partner more than anything. Thank you, Ms. Cynthia. All right. Extra question from the audience. Are there easy investments a city, state, nation can make to build a culture of health across a socioeconomic strata? The biggest investment, I would say, is legislation. And if you're thinking, well, why not money? Why not this? We need the right legislation in place to make a lot of this more seamless, right? Because for right now, a community health worker, we like them to bill for their social prescribing, right? A fee for service, so they can have an influx of an economic revenue where their jobs can be sustained well. Because sometimes proving their economic worth that we're trying to do and continue to do, it's really hard to put a dollar sign on it if we have a lot of limitations of what they can and cannot do. So legislation is a big part for me. And we have great legislators, great advocates, and we're doing that. And there's great groups who are trying to lead the calls in it. But I think the first biggest investment is, what are the barriers that we've implemented that are keeping people from achieving health? If we can remove some of those or promote some of those, the opposite of it, right? Those that promote good health. Let's focus on those and then build off of that, and then build off of that. The investment will come, but the first piece is, can we allow the good people to do the good work unopposed so they can actually achieve this notion of medicine for the greater good? The next page after that would be investing in the right spaces for the community. What does it mean to have a healthy community? And I'm often reminded of these blue zones in the world that have kind of the longest life expectancy. And what all of them have in common, if you look them up, they don't have a single Johns Hopkins there. They don't have a single prestigious hospital there. What I love about these communities, if you go in and sit with them, I've done that with only one because it's in Greece, health is such a passive thing for them. Everyone's invested in health, but it's not like they're promoting it. It's just there. Everyone feels purposeful. Everyone has access to the right diets and foods. Everyone has access to the education they need. Everyone has an investment in one another. So the next stage after that would be investing in the right variables for social cohesion to allow the communities to grow and foster and prosper in only a way we can do in Baltimore and beyond. Those, I think, will be the two biggest pillars to kind of raise up. And if we can do that, then those are the right investments. But I would say the legislation part has to come first, because that creates a great sustainability for things that we can act upon and so forth. And allows also the dynamics of recognizing community engagement does evolve rather than staying put. Money, of course, and other investments help, but I think you can't really paint that without a legislative canvas. All right, next. What can folks do who aren't doctors? Oh my God, well, this, so if you thought, so I apologize. Yes, there's a biased notion here because I'm a physician, I'm a doctor. Yes, I get that. And so I am promoting physician citizens, science citizens, et cetera. But everyone can promote health, all right? You don't need the doctor, right? Miss McCleary from Armistead, Miss Kendra from Marie G. Faring down in Curtis Bay, right? Everyone can have a role in health promotion. So if you do want to get involved, email, right? There's ways to kind of put you out there to help, whether it's hands-on activities, whether it's just promoting an organization when you go out there to help out with their green spaces. There's ways everyone can help. If there's one, I feel like everything I've said is one big outcome, one big outcome. The community I grew up in, of Baltimore, that segment, that alley, I loved. And it was the diverse alley, people from different backgrounds and so forth. But there was one kind of unifying social cohesion that was felt. And we were all in this kind of together. Granted, the proximity and propinquity of it brought us together to that, but then it was reaffirmed over and over again because we all love food. We all loved having a good time. Hey, he can fix a car. He can paint a wall. That's the big goal of all of this, right? We are welcome to live in our spaces of diversity, but how can we all feel at this level of connection? That is not an exclusive trait to being a physician. So if you want to do health for the greater good, just email. Happy to help. All right. So if you have any more questions or concerns, of course, email address is right there. I would love and invite you to go to our website, medicineforthegreatergood.com. I would also love listen to the podcast. If you want to join them live, you're not filming in a live studio audience. You can be at home listening to them. Email us, right? Join the listserv with mgg@jhmi.edu. Email us. We'll gladly add you. And then they're every Friday at 11 a.m. They open up with 10 minutes of where we've been in the community. We dive into a few health topics emailed to us. Then we go to our expert for the main event. And then we wrap up with the chaplains. They usually provide a great spiritual closing, a non-denominational one. It's always great. So we're here for you all. And let me close with this. When I 2018 joined as faculty, just like many of my colleagues, we had a lot of offers. We had opportunities galore. I do not think medicine for the greater good would have occurred in any other institution I've gone to. It was here at Hopkins that even if they didn't understand my roadmap, even if they didn't understand what I wanted to achieve, they were going to flood me with the resources and the mentorship and advocacy I was going to need to make this successful. And the success here is not mine. It is the community's, it is everyone's. So it is just an honor to present to some of the best alumni of any institution, the Hopkins alumni. And I'm hoping you all recognize that the success of this is your success as well. So thank you all so much.